Hi, welcome to MG Life Hacks, the channel for Myasthenia Gravis patients. I have a patient perspective. I am not a medical expert. This is not medical advice in any way, shape, or form. I am simply sharing my experience to try and help others with this diagnosis because the challenges can be very unique, especially even within this diagnosis. Today, I want to talk about getting out of the funk that you can fall into when you have a flare-up, or especially if you're new to the diagnosis and there are a lot of feelings and emotions that tend to come with it that really get you bummed out. Depression, anxiety, rightfully so, because of the symptoms that are involved with this diagnosis and the severity and the impact to your life. You'll have to bear with me. I'm in the lowest point of my cycle, so sometimes trying to clear my throat can be a little more work. Speaking can be a little more work, but that's the way it goes. Anyway, in tackling the downside of a flare-up, when I'm having a flare-up that is not hospital worthy or worth calling my doctor, I just know that I overexerted, and as a consequence, I am in bed, I'm resting, and I hate it because I would much rather be doing anything else at all. Anything else. There comes, emotion with that. It's sadness. To me, it feels like I've lost a battle, like I'm losing the war. And there's also a fear that comes with it of that being my new normal. Is this going to stick this time? Is this going to be really pervasive? Am I in a long-term flare-up type of thing? And while it can be any of those things, chances are it's not. But it's really hard to pop out of that mental gear when you have that kind of cycle going. And while I'm at it, speaking of that mental cycle and depression and anxiety, I cannot recommend therapy enough, especially cognitive behavioral therapy, that type of model, because it helps you identify those patterns and try and break those patterns. And it is work. It's work. You have to do homework for that. It is well worth it. And if you're worried about expense, sometimes therapists or different places will offer sliding scales, so that way you can pay what you can, and you can at least ask. The worst thing they'll do is they'll say no, they don't do that. But it's worth asking. It's worth trying to get that care for yourself. Some of the things that I do to try and pop myself out of gear is, once the worst of the flare-up is over, I can move around a little bit without severe fatigue, things that are, for me, I'm almost 4 years into this diagnosis, so I know my symptoms pretty well. I will try and do whatever self-care I can, even if it's just a little, mask where it's not a lot of work. You don't have to scrub. You just wash your face and then put it on, and then, one of those sheet masks. It's just a little pampering thing. And it makes just a little bit of difference. And I'll also use my favorite fragrance lotion because my skin is constantly dry. And, just that scent, and it's just comforting for me. So, sometimes people have like lavender, or, you could do a candle, but I generally stay away from those, especially when I'm trying to rest, because if the fatigue hits, I want to be able to just fall asleep. Put on your favorite movie in the background and just doze. Get your favorite blanket. Get yourself comfortable, and get in the mindset that you are just allow yourself to heal. Allow yourself to feel the emotions, because it is really emotional. You can't do the things that you want because of this. Be cognizant of that, but try not to wallow in it. And that can be challenging, especially if you're beating yourself up for not being able to spend time with your family, do things you want to do, the cleaning needs to be done. No, you need to allow yourself to just have this illness, because you didn't ask for this illness. You got it. And this is just one of the byproducts that comes with it. And the other thing that can come with it is guilt that you can't do these things that you want to be able to do for your family, for your loved ones, for your friends. While it's an understandable feeling, you gotta kind of let go and try and find a way to refocus that attention. Just acknowledge that it's there and say, you know what, yeah, this is not great and I really want to be able to do this stuff. What can I do? Can I do a puzzle? Can I play an online game? Can I just sit and allow myself to rest and recuperate? Because you deserve to be able to rest and recuperate. Again, you did not ask for this illness. The other things that I'll try and do to make myself feel a little better are, again, just going back to the self-care things, like give yourself a little manicure, a little pedicure. Yes, it is a little bit of work when you're in a flare-up, but again, this is on the upswing when you're like the worst of it is over and you're just still kind of trying to recover. Do try and eat foods that are good for you, because the other thing that I've noticed with flare-ups is, of course, trying to prepare food and clean up is a monumental task with this illness, especially when you're having a flare-up. Try and have some foods on hand that are very easy and quick to prepare so that you're not eating fast food or, just things that aren't super great for you. While it is nice to have foods that you enjoy that are like a comfort food, when your body is trying to recover, you might feel better, or you might notice that you feel better when you eat something that's easy to digest, that your stomach isn't going to have to really work at trying to digest and, nourish yourself with. That's what I've noticed with mine anyway. The other thing that can come with this is this dread that, again, it's going to stick and it's going to stay there. Chances are it's not. And what I try and do with mine is focus on the fact that I am, especially in my case, a flare-up means I tried a little too hard. It means I overexerted a little bit. And I take it as a win because it means I'm trying. I'm not happy about the not being able to function. I'm not happy about the flare-up, but the flare-up means I'm trying. And I try and kind of shift and spin it that way and just focus on that. At least I'm trying. I tried a little too hard, and I will set a timer on the activity that I'm doing that was new that probably prompted it, or I will write down some things to focus on that I think might have led to it, like, stress. Have I been dealing with stress appropriately and coping with that? Have I not been addressing that? Is that why I'm flaring up? Did that contribute to it? Because it can be a combination of factors, especially with generalized myasthenia gravis. But I did want to drop those hints and tips and tricks in there. And if this did not help you, you might want to check out different Facebook groups. I've mentioned it before, but sometimes folks that are, down in the dumps, everybody has different tricks to help them kind of get out of that gear or focus on something else. Focus on the things that you can do. Focus on the things that you can change once you're able, and try and think about it that way. You can also look up spoons, like there's spoons groups, like the idea being that, you wake up with a certain number of spoons, and then throughout the day, depends on how many spoons you use and what you're left with. Sometimes folks with like chronic illness, they have different tips and tricks to, get out of that mental mindset that you can kind of get stuck in. But the important thing is that you don't stop trying. Don't give up. It can be incredibly easy to do with this illness, especially during a flare-up, to just give up. Give up trying to function to a certain degree for that day. Allow yourself to rest. But don't give up in general. Don't stop trying, Because the way that you succeed with this illness, particularly, is you keep trying, and you keep trying carefully, being cognizant of your limits and keeping track of your limits and keeping track of your symptoms and what seems to make them worse. And take that ownership and responsibility to keep trying. Don't give up. Don't give up. And if you didn't find what you needed here, don't give up. Again, that's all the tips that I have. I hope this helps, and I hope you find what you're looking for if you didn't find it here. Thanks very much.